Hi everyone, this is Renee, and in this voiceover we're going to discuss cystic fibrosis. Okay, so cystic fibrosis is an autosomal recessive disease, and what that means is both parents must carry the cystic fibrosis gene in order to have an infected child. If both parents do carry the gene, there's a 25% chance that that child will be affected. It is a chronic multi-system disease with altered function in the exocrine glands of the lungs, pancreas, and biliary tract, the integumentary system, and the reproductive tract. The first signs and symptoms of cystic fibrosis usually occur in childhood, although some patients may not be diagnosed until they are adults. The median lifespan is around 37 to 41 years old. And just to give you some numbers, there's approximately 30,000 children and adults in the U.S. that have cystic fibrosis. And there's another 12 million approximately that carry the cystic fibrosis trait. Patients with cystic fibrosis have an obstruction of their lungs, pancreas, and intestines, and this is caused by the thick, sticky secretions. What happens to a patient when they have cystic fibrosis is they don't have the protein necessary to exchange sodium and chloride in and out of their cells. So a buildup of mucus will accumulate outside of the cells, and this is what causes the obstructions. So as the mucus fills and it plugs up the glands in these organs, which causes the glands to atrophy, ultimately this is going to result in organ failure. Prior to there being any loss of lung tissue with cystic fibrosis, it will initially start off with chronic bronchiolitis and bronchitis, so a disease of the small vessels. But then there is a progressive loss of lung tissue from inflammation and scarring. The chronic hypoxia or lack of oxygen in the lungs is then going to lead to pulmonary hypertension, which is an increased pressure in the lung arteries, and cor pulmonale. So cor pulmonale is a condition caused from pulmonary hypertension, and this is when the right side of the heart fails. So patients with cystic fibrosis don't excrete more sweat than the average person, but the difference is in their sweat, there's 4 times the amount of sodium and chloride in it. The specific abnormality of cystic fibrosis usually does not affect the general health of the person. The thick mucus that plugs the lungs of cystic fibrosis patients also plugs the pancreatic ducts. Now the exocrine function of the pancreas is altered and may even be lost in these patients. The pancreatic enzymes are not able to reach the intestines to digest the ingested nutrients. So because of the altered pancreatic function of a cystic fibrosis patient, fat, protein, and fat-soluble vitamins are going to be malabsorbed, and this is going to result in what's called steatorrhea, which is excess fat in the feces. These patients also have protein malabsorption, which will also result in failure to grow and gain weight. Patients with cystic fibrosis also often have a lot of GI problems, so they can experience GERD. They may have GERD because of the frequent coughing. They may have gallstones and damage to their gallbladder due to the mucus. A lot of these patients can also have distal intestinal obstructive syndrome, DIOS, and they can also have constipation. The median age for diagnosis of cystic fibrosis is about 5 months. Usually it's diagnosed based off of early manifestations, so things that we can see. One of the first things we can see is the meconium ileus in the newborn, and this will actually prompt the diagnosis in about 20% of patients with cystic fibrosis. Other symptoms include acute or persistent respiratory symptoms, a large abdomen, emaciated appearance of the extremities, and again, the steatorrhea that we talked about before. Generally, the first symptoms that we see in adults is the frequent cough that they have. When the cough begins, it's usually non-productive, but as it progresses, it becomes more persistent, and the patients will produce the thick, sticky, yellow, or greenish-colored sputum. As the disease progresses, the patients will have increased exacerbations of coughing. They will also have an increased weight loss, an increased sputum, and a decrease in their overall pulmonary function. Both men and women will have altered reproductive systems due to cystic fibrosis. Males and females are going to have delayed puberty. The male's vas deferens is destroyed. Females will also often report menstrual irregularities and may even have difficulty becoming pregnant. Some common complications that a patient with cystic fibrosis can have are bone disease like osteoporosis and osteopenia, sinus disease, liver disease, pneumothorax, which is a collapsed lung, hemoptysis, which can be life-threatening, and digital clubbing, which you can see in the picture on the slide. For diagnostic testing, the sweat chloride test with pilocarpine iontophoresis method is the gold standard for diagnosing cystic fibrosis. What happens during this test is that both armpits are tested at the same time, and this helps to eliminate unclear results. So the pilocarpine is applied to both of the armpits, and there is an electric current that is used to stimulate the sweat production. The sweat is then tested for chloride levels, and any chloride level that's greater than 60 is considered positive for cystic fibrosis. Now, if this was an unclear sweat test, what they can do is a genetic test, which is when they swab the cheek for a buccal smear and then send it to the lab. Collaborative care for the patient with cystic fibrosis. So we want to help promote this clearance of secretions, and ways we can do that is by providing chest physiotherapy, promoting activity. We want to teach our patients how to control infection in their lungs. So we want them to limit exposure to public places, and we really want to stress the importance of them not being around sick people. Providing adequate nutrition. So these patients need a lot of fluid, and they also need sodium replacement. They are also going to need a high caloric, high fat, and high protein diet. And we want the patients to manage pulmonary problems, meaning we want to relieve the airway obstruction. Aerosol and nebulizer treatments are usually the medications of choice for clients with cystic fibrosis. We use these to dilate the airways, and they help to liquefy mucus. And this is going to help facilitate clearance of the mucus, which is what we want. So DNase is used to increase airflow and reduce the number of pulmonary exacerbations. Inhaled hypertonic saline, 7%. This is effective in clearing mucus, and it also can help decrease the frequency of exacerbations. We'll also use bronchodilators to control bronchoconstriction and bronchospasms. As the nurse, we can teach our patients and their families ways to clear the airway. Individuals with cystic fibrosis often have preferences of which techniques or devices work well for them, and they will usually incorporate that into their daily routine. There is really no clear evidence that says one is better than the other, so things we can teach them is chest physiotherapy, high-frequency chest wall oscillation systems, postural drainage, PEP devices, which you're going to see on the next slide, and breathing exercises. As the nurse, we also want to educate the family that aerobic exercises can be really effective in clearing airways. But we need to ensure that these patients have frequent rest periods, have increased nutrition, because the demands of the exercise are going to increase their needs, including liquids. So we want them to have increased fluid intake, but they also need to replace the sodium they're losing through sweat as well. Another teaching point for patients with cystic fibrosis is if they have any signs or symptoms of a lung infection, they need to call their doctor right away. This is because they will often need an early intervention of antibiotics. The typical interventions are long courses of antibiotics. They do such a long course because drugs are so abnormally metabolized and are quickly excreted, so they may need high doses of antibiotics as well. Because cystic fibrosis affects the bowel, this is why the drug dose needs to be altered. So for our nursing assessment, we want to gather a health history. We want to find out their respiratory infection history, if they've had a cough with sputum production, if they have a family history of cystic fibrosis, and if they're having any dietary changes. So are they not tolerating any specific foods, and are they having any weight loss? Some other information we want to gather from our health history is asking the client if they've been having any large, frequent bowel movements. Are they having any decreased activity intolerance, any shortness of breath? Are they having any abdominal pain, anxiety or depression, cyanosis, or any salty skin? So when we're doing our assessment, we want to assess, are they having a runny nose that we can see? When we listen to their lungs, what do their lungs sound like? Are they diminished? When they report that they have sputum, we want to look at their sputum. What is the color, consistency? Is there an odor? If it is blood tinged, this is what we call hemoptysis. And are they using their accessory muscles to breathe? These are very important observations that we need to make during our assessment. We may also see tachycardia during their assessment. We want to assess if they've had any foul, fatty stools. And that is from the statorrhea that we talked about. They will also have protruding abdomens, so abdominal distension is likely. And they will also have abnormal arterial blood gases.